big thumbs up and leave a comment down below.
Hi, I'm Dr. Tinglestorm, and today you're here for a comprehensive full medical exam. Okay, I'm just going to palpate your notes and your face to feel the muscular articulation as I ask you a couple questions. Is it okay for you if I do so? Okay, thank you. So, have you had any health issues lately? Any previous medical history of neurological damage or dysfunctions? Okay. Do you happen to feel dizzy? Do you experience blurry vision? How about some hearing loss or alteration? Do you happen to perceive any abnormal tenderness or numbness in your body? Okay. Do you smoke? How about the alcohol consumption? Do you use any recreational drugs? No judgment here, just need your honesty, okay? I won't tell anyone if that's your concern. Do you drink a lot of caffeinated drinks, energy drinks? Are you currently on a diet? And how are your eating habits? How many hours do you sleep? And do you have a regular sleeping routine? Do you go to sleep and wake up at the same time? Okay. Okay, so do you have any allergies? Okay. Any hypersensitivity to some products or foods or metals? Alright, everything looks good. Okay, so I would start with the eyes, okay? As I've already palpated your orbital bone, okay? Just doing it once again for extra safety. And this time open your mouth real wide. And now clench the teeth. Okay, so as I've already done the palpation of the orbital bone, I would just go with the eyes first, if that's okay with you. Initially, I just want to ask you to follow my finger. Just with your eyes without moving the head. Warming up your vision here. Okay, now I'm gonna need you to look at my nose and tell me when you no longer see the fingers in your visual field. Good. Now we're gonna start with a little light, okay? It's not excessively bright, but it can be upsetting to some people, so we're gonna start slow. I'm gonna be warning you that it's gonna be up in 3, 2, 1. There it is. So initially, I don't want you to follow it. just get used to the fact that you're gonna be a flashing light. There's gonna be a flashing light in your visual field, okay? Letting your pupils slowly dilate. And we relax, yeah? We relax. Alright. Would you be ready to follow this light? Just with your eyes as we did with the finger without moving the head. Perfect. At the best of your abilities, I know sometimes it's gonna be a little bit too fast, but I need this to check if there is any spasm in the eyes. Okay. We move in circles and we change directions. Okay. Now the light is gonna go very far away. Very far away. Good. Do you see it? And can you follow it right now? Good job. And can you follow the light as it comes closer until your eyes can no longer? And you tell me when that happens, when it's so close that your eyes can no longer follow it. Good. Let's do this one more time, okay? So you look at the light here and you do follow it at first. Good job. Alright, and now the light will come closer and you keep following it until you can no longer, and you warn me when that happens. Good. Good job. Okay. Look at the light and you look at the light and tell me without moving your gaze from here, how many fingers do you see with the other hand that I'm moving? Okay, never get distracted and keep focusing on the light. Okay, take a moment, you blink, and we do this again. So look at the light, this time it's gonna be farther away. And you focus here, and you tell me how many fingers do you see with my other hand. Never take the gaze away from the light. Keep looking at the light. Good job. I'm gonna have a look at your pupillary response. So for this purpose, I'm gonna be using an eye occluser. The eye occluser is meant to block the light. So as you can see, if I place it here, you cannot see anything, right? So I'm gonna be flashing the light into one eye. The other one is gonna be blocked. I'm gonna see how your pupils react to the light, how fast they shrink and come back to their natural size, okay? So the light is gonna be quite up close. I need you not to look at it this time. So opposite direction to what we did so far. You don't look at the light as I look at the direct response of your pupils. Is it too bright? Okay. Just another little bit of your patience here. Good. Right. Now we switch Do you need a moment to reset? You just take a moment to reset. You blink. You take a nice breath. And we do this one more time. With the other eye being closed this time. And I am just flashing the light in your visual field. But this time you don't look directly at the light, okay? As it's close. And I'm gonna need to see how your pupils react when being directly stimulated by the light, and so far so very good, which is amazing. Great. Now I'm gonna be splitting your visual field into two halves, and I'm gonna check your consensual response. So if I flash the light into one eye, I'm going to expect the other pupil to react as well, consensually, so not directly stimulated, okay? Splitting the visual field right here, and I am just flashing the light here, but looking at the reaction there. Good. That's looking good. That's looking really good. Okay. Do you feel any discomfort in this moment? No, you don't. That's great. Let's do on the other side now. Yet again, flashing the light into the other eye, but looking at the reaction of this one instead. That's looking good. Looking really good. Good. Very good job. Very good job. Okay, wonderful. Now I'm gonna look at the fundus of your eye. So I'm gonna be gently splitting your lids open. I'm gonna be as gentle as I possibly can. Okay, I'm gonna need to see how quickly your eye dries out. So I'm not gonna let you blink instantly, but you're gonna blink soon, okay? And I'm gonna need to follow my instructions as I do so. Am I allowed to start? Of course, if at any moment the discomfort is unbearable, you do let me know. You don't even need to speak, you just raise your hand, okay? Okay, so open it up. Look in here. I'm gonna need you to look up. And now you look down. Good. Look left. And look right. Okay, now look straight ahead for me, please. Good, and blink. How did that feel? Okay. Glad it wasn't too upsetting. I'm gonna do this again with the other eye. Are you ready? Gently splitting open. Good. Okay. You look up. You look up. You look down. You look left. And you look right. Good. Look straight ahead for me. Perfect. And now relax and blink. 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 I'm looking at the vascularization now, so I'm gonna pull down the lower lid. Okay. Relax. Okay, can you look up? Good. Good job, okay. Relax. I'm gonna do the same thing with the other eye. Pull down the lower lid. Okay, good. Look up. Good job. And relax. I'm gonna pull up the upper lid ever so gently and look down. Good job. Okay. The other. Ever so gently look down. Alright, good job. And relax and blink. Vascularization and lubrication of the eyes are really good. Let's now have a look at your vision. So let's start from this one, okay? Can you read the first line? Okay, good. And can you read the second line? Okay, good. As you can see, these are not particularly hard to see, but do you have a better time seeing on the red or on the green? Okay, so same. Let's try with this lens, okay? You go back to the first line. Okay, and now the second line. Is there any better? I see. Okay, perfect. Let's try with this lens instead. Okay, first line and second line. Interesting. Any better green or red? No? Okay. And how about now? First line, second line. Any better green or red? Alright. Good job. Let's now test your vision instead. Okay. So we have the Snellen card right here. I'm gonna use you read the first line. Good. Read the third line. Okay. Can you read the fifth line? How about the bottom lines? Okay. Let's try with this lens now, okay? Good. Can you read the first line? Can you read the second line? Good. How about the second last line? Alright. This lens. Can you read the first line? Not even the first line. Good. Now, can you read the first line? Second line? Fourth line? Fifth line? Okay. No. Can you read the first line? The second line? Fourth line? Fifth line? Okay. It's okay, do not worry. Good. Let's now move on to the ears, okay? Just gonna have a quick otoscope inspection, looking inside the ears to see the condition of your ear canal and if you have any abnormal wax buildup, okay? I'm gonna be coming very up close to inspect. Is that okay for you if I do so? Alright, good. Just inspecting here inside of the ear. Okay, good. Do you feel any pain or discomfort as I do so? Could you please open up your mouth real wide? And now clench your teeth real tight. Oh, good. Relax. Just manipulating your ear a little bit right now to see the eardrum and
Taking good care of your ear health. Ear canal is looking nice and clean, no irritation or discrimination. Now gently manipulating to have access to the eardrum, which is also looking in perfect condition. Good job. Very good. Alright. That's amazing. Glad to see that you are taking such good care of your overall health in general.
Okay, so the ears are doing well. I want to do a quick hearing test with my tuning fork that I'm gonna ring, and I'm gonna need you to tell me whether you hear it to the left, to the right, and all the jazz. Up close, far away, when it stops. That's what I mean with all the jazz. Do you have any trouble hearing it? Okay, let's try it just one ear. The other. Okay. You also hear it moving from side to side, right? Okay. Let me now whisper some words into your ears, and I would love you to repeat them for me.
Crocodile, charcoal, pineapple, chocolate, coconut, strawberry, curtain, clock, Coca-Cola, pillow, keyboard, staircase, closet, cloud, skin, school, scar, shoe, fence, grass,
Okay, very good. Hearing is also working wonderfully. Now I'm just gonna have a look inside of your mouth, okay? I'm gonna need you to open up your mouth real wide as I have a look inside, okay? Just open up for me.
just to look in to see if there are any inflammations or cavities. I'm gonna be very gentle. But if you feel any discomfort, of course, you can let me know at any time. Just trying to see if I am looking with my tool or if everything goes alright. Because if the tool hooks, it means we have cavities. But if it doesn't, then we don't.
Okay, everything is looking good. Just want to have a look at your throat. So So I'm gonna be using a tongue pusher. Gonna be needing you to open up real wide and stick your tongue out for me. Say ah. Alright. Everything is looking okay. I don't see any irritation. The oval eye is looking at its normal dimensions. So no swell or redness in there as well. Can you try to swallow for me? Okay, looking good. Say alright, that's good. Okay, just another tiny little bit of patience for me. Can you say okay, good, like that. Okay. Everything is healthy inside of your mouth as well. Now instead I'm going to be using another scope, and I want to have a look inside of your nose with this. It's very tiny, so it won't bother your breathing, okay? The air will flow normally. Okay, I'm coming real up close and I'm asking you to breathe normally for me. As I do so. Oh, good. Stay as relaxed as you can. Looking at the other nostril as well, seeing if there is any septum deviation whatsoever. Everything is looking okay. Now I'm closing one nostril, okay? I'm gonna need you to breathe normally. Okay, good job. Just look at how the air flows and enters. Okay. And I'm gonna do the same thing with the other nostril. Okay, so you do breathe normally. Okay, and I look at the air flow if there is any problem with the turbulence or as well in general, any abnormality in the nostril itself. There could be a little, but I don't happen to see anything at all. Another little pig. Breathe normally for me. Do you experience any problem breathing, any occlusion of your nostrils, or any particular dryness that almost feels like a burning sensation? Alright, everything is alright. Just want to have a look at your overall posture now. Okay, so is this how you normally stay? Okay. I'm gonna be using this little hammer to test your reflexes. So I'm gonna be gently dabbing it onto your joints. It won't be painful though, okay? Relax. Okay. Any pain? Okay. That was my hip once again. Alright. Now I'm gonna be applying a little bit of pressure into your abdomen. See if there is any fluid retention here. Are you regular with number 2? Okay. Just applying a little bit of pressure now. Any particular pain or discomfort? circulation is healthy. Let me just quickly listen to your heartbeat. So let me do that for you because it's really cold. Okay, if you could gently uncover your chest for me. Thank you, and breathe normally. Nice. Now coming behind you to listen to your lungs, okay? So you stay as relaxed as you can as you kindly uncover your back for me. Breathe normally for me. Wonderful job. I hope that the stethoscope is not too cold. Okay, stay as relaxed as you possibly can. Another tiny little auscultation, then we're done. Lungs look clean and free. That's great. Okay, the lungs are in perfect health as well. The exam has come to an end. I hope it was pleasant. I hope you found it relaxing. I am very honored that you chose me as your specialist today. And I would just kindly ask you to give this video a thumbs up, leave a comment down below, and consider subscribing if I made you tingle or helped you sleep, as these little actions are free for you, but they mean the world to me. You can also have access to my weekly uploads, which happens to be twice a week. And if you're subscribed, you don't miss them. You can find me on all social media, and you can listen to my audio